Hi, welcome to our YouTube channel. Today in this video, we will talk about 5 warning signs your blood pressure is skyrocketing. To stay up to date with my latest videos and cool health tips, make sure to subscribe to this YouTube channel. High blood pressure, also known as hypertension, is a common condition that affects millions of people worldwide. It occurs when the force of blood against the walls of your blood vessels is too high. High blood pressure can put a strain on your heart and blood vessels, increasing your risk of serious health problems such as heart disease, stroke, and kidney disease. It is often referred to as the silent killer because it often has no warning signs or symptoms. However, there are certain warning signs that your blood pressure may be skyrocketing, such as headaches, dizziness, and shortness of breath. It's important to be aware of these warning signs and to take action to manage your blood pressure if you experience them. Number 1. Headaches. Headaches can be a symptom of high blood pressure, also known as hypertension. When blood pressure is elevated, the force of blood against the walls of the blood vessels can cause damage and inflammation in the blood vessels in the brain, leading to headaches. These headaches can be dull or throbbing, and may be accompanied by other symptoms, such as blurred vision or nausea. If you are experiencing frequent headaches along with other signs and symptoms of high blood pressure, such as dizziness, chest pain, or shortness of breath, it's important to consult your healthcare provider as soon as possible to have your blood pressure checked and to discuss a plan for managing it. Keep in mind that headaches may have other causes, and high blood pressure is just one of the factors that can be associated with headaches. Thus, visiting your healthcare provider and getting checked is crucial. Number 2. Shortness of breath. Shortness of breath, also known as dyspnea, is a common symptom of a condition called pulmonary hypertension. Pulmonary hypertension is a type of high blood pressure that affects the blood vessels in the lungs. It occurs when the blood vessels that carry blood from the heart to the lungs become narrowed or blocked, making it more difficult for blood to flow through them. As a result, the heart has to work harder to pump blood through the lungs, which can cause shortness of breath. This symptom can be mild at first, but as the condition worsens, it can become more severe, interfering with daily activities and making it difficult to breathe even when at rest. Other symptoms of pulmonary hypertension can include chest pain, fatigue, and fainting. If you have a history of lung disease or heart disease and experience shortness of breath or chest pain, fatigue and fainting. If you have a history of lung disease or heart disease and experience shortness of breath or chest pain, it is important to consult your healthcare provider as soon as possible to have your lung function and blood pressure checked, as well as to rule out pulmonary hypertension as possible diagnosis. Number 3. Anxiety. Anxiety and high blood pressure are linked in a number of ways. High blood pressure, also known as hypertension, is a common condition that is associated with chronic stress, which can be caused by anxiety. Anxiety activates the body's fight or flight response, which causes the release of stress hormones such as adrenaline and cortisol. These hormones can cause the blood vessels to constrict and the heart to beat faster, leading to an increase in blood pressure. People who have anxiety disorders may also be more likely to engage in behaviors that can contribute to high blood pressure, such as smoking, overeating, and drinking too much alcohol. Studies have shown that individuals who suffer from anxiety disorders have higher chance of getting hypertension. Also, with hypertension, the likelihood of suffering from anxiety disorders is increased. There is a lot of research being done on the relationship between hypertension and anxiety. If you experience symptoms of anxiety, along with high blood pressure, it's important to consult your healthcare provider as soon as possible to get an evaluation and to discuss a plan for managing both conditions. Number 4. Nosebleeds. High blood pressure, also known as hypertension, is not usually a direct cause of nosebleeds. Nosebleeds, also known as epistaxis, are a common problem that can be caused by a number of factors such as dry air, injury to the nose, or nasal or sinus infections. However, hypertension can indirectly contribute to nosebleeds by damaging blood vessels in the nose. When blood vessels in the nose are damaged, they can become fragile and more prone to bleeding. Additionally, hypertension can also cause blood vessels to enlarge, increasing the likelihood of rupture, which also may lead to nosebleeds. This is particularly true if hypertension is uncontrolled, or if the patient have uncontrolled hypertension for a long period of time. However, it is important to note that hypertension can have a lot of comorbidities and symptoms. If you experience frequent nosebleeds and you have high blood pressure, it is important to consult with your healthcare provider to rule out other potential causes and to discuss the best management for hypertension. Number 5. Nausea and vomiting. Nausea and vomiting are not common symptoms of high blood pressure, also known as hypertension, but they can occur in certain situations where blood pressure spikes suddenly. This is called a hypertensive crisis, which is a severe and dangerous increase in blood pressure. A hypertensive crisis can occur when blood pressure rises to extremely high levels, such as 180/120 millimeters or higher, and is accompanied by symptoms such as severe headache, chest pain, vision changes, and difficulty breathing. Nausea and vomiting may occur in these situations as a result of the body's response to the increased pressure. This is a medical emergency, and anyone experiencing these symptoms should seek immediate medical attention. Keep in mind that nausea and vomiting can be caused by a variety of other factors and not always linked to high blood pressure, but it is always important to check with your healthcare provider if you experience these symptoms along with other signs and symptoms of hypertension.